I'm Karen Van Tynen. I've been a practice administrator for more than 16 years with the Presbyterian Medical Group here in Albuquerque, New Mexico. I've managed 40 providers for urgent care and occupational medicine. Recently, my position was eliminated, and I now find myself with a wonderful opportunity to seek a new leadership position in ambulatory care. What I'd like you to know about me is that I am a patient and people-centered leader. My vision is to create a practice for the patients to receive the best medicine possible, for providers to practice medicine, and for the staff to work. I will accomplish this with my experience as a leader, using understanding, my knowledge, my sense of humor, and with kindness. To my surprise and delight, many of the providers asked when I was leaving the medical group if they would have the opportunity to make a recommendation for me. In this video, there are some of those recommendations included where they talk about my management and leadership skills.
Hi, I'm Bill Doherty, a physician in Albuquerque. I've been practicing here for about 30 years and have known Karen Van Tynen for about 16 of those years. I have known Karen to be kind is the first word that comes to mind, loyal, but mostly unflappable. I've seen her go through extremely difficult times when our system was under great stress, and she comes through always with honor, integrity, a sense of humor, and she gets the job done.
Hi, I'm Endel Sora. I'm one of the physicians at Presbyterian. Is really people-centered, and she realizes that the value of people is what makes the practice run. She has a way of seeking out the positive attributes that people have. She rewards people for their actions, for their behavior, for their dedication to their work, and she just makes people want to work harder for them, for her and for the clinic. To continue working for Presbyterian or working with Karen Van Tynen in another organization, I'd work with Karen. How she cares about people. She manages almost not transparently, but invisibly. You could walk in, mention something to her in passing, and before you know it, it gets done. And I would love to work with her again.
I'm Shawn Funnerhouse, and I'm a physician assistant, and I've known Karen Van Tynen for the last 9 years. I have enjoyed working with Karen so very much, and the leadership skills that she's helped me foster as a mentor have been unprecedented. I've been able to grow in the organization, and I currently serve as the mid-level lead. Karen as a manager has always been a real pleasure to work with. When we've had troubles and difficulties over the years in urgent care, she has been the first one on the battle lines. She's always made patient safety a priority #1 and has made it a real pleasure to work in urgent care.
With Bill Brady, I'm the medical director for occupational medicine and employee health. She has been instrumental in keeping the occupational medicine clinic functioning. She has been my colleague in terms of working with the staff, helping the staff to go through various stages in their development, working with the financial aspect about the staff, and ensuring that the clinic remains viable. I have found her to be extremely helpful in all these different areas. Since she has left, this has been a major black hole for the clinic. We have not had anybody that has the in-depth knowledge that she brings to clinic management. She has an extraordinary ability, and with working with finance, and to understand the numbers. The clients of the clinic have enjoyed working with her for years. They've been calling me on a weekly basis, asking me about her. wanting to know how they can get in contact with her. So I think that any clinic or any medical facility that has Karen Van Tynum as their manager is going to find that to be a very major asset for them.
My name is Chris McElwain. I am the medical director for PMG Urgent Care Services, a very busy medical practice of about 40 medical providers and 5 different sites in Albuquerque. Karen Van Tynum brings a lot of experience to the table as far as running a medical practice. Things that best describe her: she's incredibly empathetic to the needs of everyone involved in a process. She has an ability to think, plan, and process in 3 dimensions, meaning she's able to see beyond the obvious and account for and plan to help anticipate problems and organize things to lay the smoothest road possible going forward for any particular task. One of the things that that really would benefit any group that works with Karen as a practice administrator are a lot of the things she brings to the table, including organization, knowledge of software, multitasking across such things as budgets and schedules. She is a very capable person when it comes to managing some of the human resource elements, including conflict resolution. One of the things that impressed me most with Karen, working with her on some of the human resource aspects, was her fund of knowledge of and depth of memory when it came to recognizing cyclical problems that come up, I think, in any practice, how best to manage those, personality styles, and also just having her as an educator to orient me and bring me up to speed on any given topic that came up in the urgent care day-to-day business.
Hi, I'm Dr. Leon DePriest, well-rounded individual who has a very valued experience in administrative skills and also personal skills of working with a diverse group of individuals, which can be difficult in the medical field, especially when you're dealing with physicians who are high-profile, highly regarded individuals, and also mid-level personnel. I have a very high regard for Karen Van Tynum. I miss her dearly, and she helped me a great deal during the times when I needed her most as a backup and resource person during the years that I was medical director for Presbyterian Urgent Care.